Hello, everyone. Good morning. We're going to give folks just another minute to hop on, and in the meantime, we have a video to share with all of you.
Without Second Harvest or the food pantry here at school, it is extremely difficult to feed my boys. I didn't realize how hard that would be once I started school full time again.
Sí es difícil ahorita ya la actualidad, ya todo está muy caro, ya sí.
Sometimes like you have to cut out certain things to get a meal for one day.
At the end of the day, it helps a lot.
All right. Good morning, everybody. Thank you so much for joining us today. We are so excited to share our 2026 policy platform with all of you today. There's a lot going on at the federal and state and local level as it relates to food access and food insecurity. So we're going to provide a little bit of context for the environment that we find ourselves in, how that's impacting our local community, and how our organization is poised to continue to support our neighbors' immediate needs while also looking toward the future and how we can make change at the policy level. Going to start off by introducing Leslie Bacho, our CEO, to kick us off.
Thank you, Rachel. It's great to be with you all this morning. At Second Harvest, we talk a lot about the fact that ending hunger in our community is possible. We have the resources to do it, but it will truly take all of us working together. So thank you all for your partnership in this work and your commitment to helping us ensure that everyone in our community has access to nutritious food. Of course, this year, Second Harvest and the communities we serve have been navigating a whirlwind of changes, many of those that have been driven by changes at the federal level. And even though many of the changes we're anticipating from HR 1 haven't really taken effect yet, we know that many of our neighbors are feeling a lot of uncertainty over what those changes will actually mean for them and their families. So this morning, we're going to go into a little more detail around the changes that we're seeing and the changes that we're anticipating. And we're really grateful to have this time with all of you to talk about these impacts. And we'll, of course, have time for questions at the end. I think it's always helpful to start these conversations with just a quick overview of Second Harvest and the role we play in our community. We have a very simple mission. Our mission is to end hunger in our community. And we have a commitment to do that by both meeting the very urgent and immediate need for food assistance, while also looking for ways we can make progress on the root causes of hunger. Today, we are providing direct assistance to 1 in 6 people across Santa Clara and San Mateo counties. And we also do a lot of work to connect our clients with food assistance programs they qualify for, in addition to connecting them with our sites. And then we advocate at the local, the state, and at federal levels for programs and policies that both support food and nutrition programs. But again, we're also looking for places where it will be effective for us to lend our voice to address the root causes of hunger. I'm going to show you just a map here, a very general map that just illustrates the power of our network. We provide food assistance to every zip code in our region, which covers all of Santa Clara and San Mateo counties. And we do this work entirely through partnerships. We are fortunate to be partnered with more than 400 nonprofit partners across the region who distribute food at more than 900 locations each month. And these partners include, faith-based organizations, after-school programs, shelters, senior centers, hot meal providers. We have just a real breadth of amazing, powerful partners that help us do this work. Most people are surprised to learn that any nonprofit who is providing food assistance in the region is likely sourcing at least some, or in some cases, all of their food from Second Harvest. And that is always at no cost to the partner, and of course, no cost to the end recipient of our services. We try to be woven into the community in places where people live, work, and gather. And we have a commitment to serving folks with care and compassion and to be really welcoming to everyone, regardless of identity or background. I think if you go, Jenny, to that last slide, I just want to emphasize that the value of the food we provide across both our counties is the equivalent of $189 million worth of food, because so much of our food is donated, and I'll talk a little bit more about that in a moment. And because we are so reliant on volunteers, for every dollar donated, we can provide enough food for 2 meals. And many people are surprised to learn that the majority of our funding does come from individuals. Government support is critical to us, but it is less than 10% of our funding. And then we also receive commodities from the federal government. And I'll talk a little bit more about that in a moment. You can see here that the need for nutritious food continues at near record levels. During the pandemic, we literally doubled the number of people we were serving and the amount of food that we're providing. But most folks are surprised to learn that that level of need has stayed pretty steady. We are, as I said before, serving 1 in 6 individuals in our community. And the challenge has been we're continuing at this service level, but doing it with a lot fewer resources. We know that for families in our region, they are facing, continue to face rising costs of food and housing and childcare. And even before the threat of the budget cuts under HR1, our clients were already really stretched very thin. So we know that even those who are eligible for CalFresh, that it is often not enough to cover the real cost of feeding their families. A lot of folks are really curious about where the food we distribute comes from. As I said before, we're fortunate that the majority of our food is donated, and much of that is food that we rescue. You can see on this pie chart, the big piece of the pie is produce that we receive through a program with our state association, the California Association of Food Banks. We are partnered with packers and growers to receive produce that sometimes is just excess produce, sometimes it is sunburnt apples, sometimes it is funny looking carrots, but all perfectly delicious. And we're able to just pay a handling fee and the transportation to bring that to us. 16% of the food that we provide is rescued groceries. We are really the largest retail rescue organization in both our 2 counties. This is something that we have been doing for a long time, but then with SB 1383, that certainly incented more retailers to participate in our grocery rescue program. And we do this in partnership with our nonprofit partners. So we are often providing training and that connection to your local Safeway, and sometimes some simple things like sometimes something big like a refrigerated vehicle, and sometimes just simple things like blankets and thermometers and things that help with that grocery retail pickup. You can see here 9% of our food came from USDA commodities. During the pandemic, we received a lot more commodities, and these are really valuable items that give us a lot of variety. They are often critical items that we otherwise have to purchase, like milk and eggs and protein. And we have really gone back to a more robust food purchase program to try to provide the kind of variety we know that clients and our partners need. So you can see 15% of our food is purchased, and then the rest come from donations from manufacturers and other smaller sources. The last thing I want to touch on is that we are in the process of building a new facility. As I mentioned before, during the pandemic, we literally doubled the number of people we were serving and the amount of food we're providing, and that stretched our resources really thin. During that pandemic, we kind of began to cobble together a emergency solution that was very effective at helping us meet the need, but really just built as a temporary solution, not a long-term one. And this new facility will allow us to really unify our operations and do this work even more efficiently and effectively. It'll give us more space for volunteers. It will give us the really adequate refrigeration and the ability to flex and grow in the future as needed. We will continue to have a small satellite in San Mateo County for agencies that come in to select food. But just as it is today, where most of our food is handled in San Jose and then goes up and down the peninsula, we will be doing that out of our new facility. Of course, we're not doing all this work alone or in a vacuum. HR1 driven changes to SNAP, which of course we call CalFresh, really directly impact the people we serve and how we operate. We are the biggest CalFresh assister next to our two counties in our region, and we work very closely with our county partners. So I'm pleased to introduce Robert Sacasa, who is the Assistant Director of the Department of Employment and Benefit Services at Santa Clara County Social Services Agency, to tell us a little bit more about the impacts of HR1.
Thank you, Leslie, and good morning, everyone. I am going to, in the next few slides, I'll review who is impacted by HR1, the impacts on the Social Services Agency and the Department of Employment and Benefit Services, or DEBS, funding, the effects on CalFresh and medical benefits, and finally, the actions the department is currently taking. Next slide, please. HR1 impacts our community and clients, primarily targeting low-income families and individuals, immigrants, refugees, and communities of color. It's a multi-pronged attack focusing on strict work and reporting requirements, which will result in people losing benefits, even when people are meeting those work requirements. And it imposes unprecedented cost-sharing requirements on the state and counties. Next slide, please. 53% of the Social Services Agency annual budget for fiscal year 25-26 comes from federal funding. 39% comes from state funding, and less than 10% come from the general fund. Federal funding is passed through from the state to county governments for social services program implementation, and the county currently receives federal funding based on administrative, cost share, and benefit enrollment. Next slide, please. In Santa Clara County, 125,000 people rely on CalFresh benefits to cover their food expenses. 26% are children under 18, 31% are older adults age 65 and older, and 43% are adults age 18 to 64. Next slide, thank you. I'm going to review a few of the most important provisions of HR1 related to CalFresh. First are the expanded work requirements, which ultimately affect 55,000 individuals. HR1 expands the upper age requirement to 64 years old. Formerly this was the age limit was 54 years. HR1 removes exceptions for homeless individuals, veterans, and those 24 and younger who aged out of foster care. And HR1 limits the exception based on responsibility to care for a dependent child to those with a child under 14 years of age. Previously, it was 18 years. Waivers to the work requirement are available, but are unlikely to be granted in the future. Waivers to the work requirements are available for areas with an unemployment rate of 10%. And next slide, please. Expanded work requirements target the most vulnerable. Impacts will be felt by those who need food benefits the most and those who are most at risk of not meeting the requirements. This includes former foster youth who aged out of care and can't get a job, elderly individuals who may face challenges with obtaining and uploading work verification requirement documents, homeless individuals, college students, veterans. Many CalFresh recipients are working but are still at risk of losing benefits due to the red tape. Next slide, please. Immigrant ineligibility. We all know that HR limits the eligibility to U.S. citizens and lawful permanent residents, and it removes eligibility for certain longstanding or humanitarian statuses, apart from certain Cuban and Haitian nationals and COFA nationals. The county impact will be 2,000 individuals. The estimate of 2,000 individuals is on the low end and is likely to increase because USDA FNS is expected to utilize a narrower definition of lawful permanent resident than the one used in CalSAWS, which is our state system. And COFA migrants refers to citizens from the Federated States of Micronesia, the Marshall Islands, and Palau, who are allowed to live and work in the United States under the Compacts of Free Association, or COFA. This agreement classifies them as non-immigrants without visas, enabling them to engage in occupations and establish residence in the U.S. without needing a green card. Next slide, please. The cost shifting to states and counties. This is pretty significant. Administrative cost shifting reduces federal contribution from 50% to 25%, making states and counties liable for 75% effective October 1st, 2026. Benefits cost shifting requires states to contribute to the cost of food benefits for the first time in history. This is going to be effective October 1st, 2027. These costs will likely be passed on to counties given the state of California's own fiscal challenges. Estimated county impacts will be $7 million in fiscal year 26-27 and rising to $70 million in fiscal year 28-29. Next slide, please. Some possible community member concerns. Some immigrants may fear that using public benefits like CalFresh could jeopardize their status or lead to deportation. Some people with unsatisfactory immigration status are fearful that their information will be shared with immigration and custom enforcement authorities, and the belief that their benefit amount will be too low to make it worth the time it takes to apply and to renew eligibility. Next slide. So what the department actions are in response to HR 1. Outreach. We are partnering with local clinics, schools, community-based organizations to reach anyone who may be affected by HR 1. Outreach efforts include providing community members with multilingual materials and culturally responsive messaging, as well as emphasizing renewal deadlines and documentation requirements. We are launching a mail campaign targeting to all non-exempt ABOD individuals ahead of implementation. Each client will receive a cover letter and an ABOD screening form that allows them to self-identify potential exemptions or opt for voluntary participation in the CalFresh Employment and Training Program. We will be placing flyers in all our county lobbies and posting social media messaging to encourage the return of ABOD screening forms and client engagement. There's also a new ABOD unit being formed. A dedicated unit will be established to manage client engagement, assessment, and tracking for individuals referred to them. Their key responsibilities include orientation and assessment, communication with eligibility staff to assure accurate system entries, tracking participation, and providing supportive services. The unit's work will include expanding the CalFresh Employment and Training Program, recruiting additional workfare sites, and facilitating volunteer opportunities. And finally, data monitoring. A monthly dashboard has been developed to provide a clear, at-a-glance summary of full ABOD caseload. It includes exemption status, exempt versus not exempt, a detailed breakdown of exemption reasons, and a dedicated tab quantifying the additional individuals impacted by HR 1 provisions that eliminate specific exemptions and expand work requirements. State meetings and work group participation. We're actively participating in various work groups convened by the California Department of Social Services to support the implementation of HR 1 in the county. And we will continue to work with the state for possible improvements to the system, the state system, CalSAWS, by improving data matches to automatically exempt as many enrollees as possible from reporting and improve the process of reporting work activities. Next slide, please. Communication and outreach. In collaboration with partners, SSA engaged in a major communications and outreach blitz via messaging directly to clients and vendors, messaging to all district offices, messaging through internal and external partners, social media, press releases, media inquiry responses. Next slide, please. The importance of partnerships. Partnerships and collaboration with CBOs and other county departments are extremely important in our strategy. Leveraging partnerships allows us to access a wider population base, share resources, and impact more CalFresh recipients. Next slide, please. And here is an example of outreach work that we partnered with Second Harvest on to help mitigate the devastating effect of delayed benefits on CalFresh recipients due to the government shutdown. We identified where our clients live and then where they shop. We collaborated with our partners on 2 data-driven census tract initiatives. First, we partnered with Second Harvest to ensure that there are enough food banks available in locations where people need them. To accomplish this initiative, we used census tract data and CalFresh recipients' addresses in our state system, CalSAWS. The SSA DEBS team, data team, created a map of CalFresh recipients by geographic area. Second Harvest is using this data to understand where the concentration of CalFresh recipients reside in Santa Clara County. Next slide, please. In addition to working with external partners such as Second Harvest, we also partner internally with other county departments. Here's an example of a project that we partnered with the Public Health Department on. SSA, DEBS, and Public Health Department collaborated on a grocery store initiative. Public Health Department staff created a tracker to distribute SSA flyers during the federal shutdown. The tracker includes a list of priority grocery stores by EBT transactions, and this partnership has ensured that these flyers landed in the hands that needed them most. An interesting note, there was a mixed reaction to these flyers in the community. Some grocery stores took those flyers and were happy to receive the resources. They were already getting questions from folks about why EBT cards weren't working, while many Safeway stores denied them due to the need for corporate approval. Other internal partnership information with Public Health. Public Health printed 4,000 CalFresh flyers to be distributed at specific events. The Santa Clara County Office of Education, school districts, shared CalFresh flyers with all superintendents and districts. The county library system, sharing CalFresh flyers across 8 county-run libraries. Coordination with the United Way 211 for information distribution with nonprofits and CBOs to understand the local response to food distribution. And finally, WIC. We partnered with WIC for mass messaging content to promote WIC enrollment, and mass messaging was sent on October 31st to a population of 4,839 households. Next slide, please. So partner with us. Host an ABOD workfare site. Partner with our employment services team to host a workfare site for able-bodied adults. Please reach out to Stacy Serrano, one of our employment services managers, if you are interested in partnering with us to host an ABOD work site, and contact information is here. And finally, The impacts of HR 1 are devastating to many members of our community. Collaboration with county and community based partners is the only way to ensure that households stay prepared for the uncertainty to come. Thank you for helping us, and together we can continue to meet the needs of our client population. And I'll toss it back to you. Is it Rachel?
Yes, Robert, thank you so much for sharing the context that we find ourselves in. But I am going to answer the question that I see in the chat. Are we seeing something similar in San Mateo County? Absolutely. Though Robert is from Santa Clara County, all the impacts that he has shared certainly apply to San Mateo County as well. And that 55,000 number that he mentioned as the CalFresh population subject to ABOD, it's roughly 40% of the CalFresh population, a very similar stat in San Mateo County as well. So the numbers are a little bit different. The counties are a little bit different sizes, but the impact is roughly the same. Thank you so much, Robert. Next, I'm going to hand it off to Patricia Cervantes from our Food Connection team. Patricia, can you share just a little bit about what you're hearing from our clients and what you're hearing out in the community? Thanks.
Thanks, Rachel. Absolutely. So part of what I do is I go out in the community and conduct outreach at resource fairs, schools, and when we're out or even when we're answering our 1-800 number, we often hear concerns from the community. So aside from, in addition of the changes that Robert mentioned of the HR 1, there's concerns about immigration. Um, I just, not too long ago, I was actually talking to someone from San Mateo area, and this person, she's a single mom of three, and that she was concerned when I was telling her about the services that we provide and talking about CalFresh food benefits. First, she didn't want nothing to do with CalFresh food benefits because she was afraid that if she applied for CalFresh food benefits, her information was going to be shared. And she's the only provider in her family and her three kids. And so just the thought of her information being shared and then later being deported, she decided not to do anything with CalFresh food benefits. Then I start talking about our free grocery program. And same thing, she didn't want nothing to do with the free grocery program because she thought that we were government affiliated. And so when I assure her that, that she can rest assured that we can provide her groceries, she can remain anonymous. She doesn't have to provide us with anything. That gave her a little peace of mind. Knowing that she would have access to free groceries. I told her what the food that she will be receiving. She was very pleased, very happy to be able to at least have access to that. But definitely a big concern with immigration enforcement. Um, Part of what I do is I work with the team, a Food Connection team, and what we do is we answer our 1-800 line. And we have in-house languages support Vietnamese, Spanish, English, Tagalog, Cantonese, Mandarin, and often we answer every call, we answer it live. And just like the story of this lady, her concerns, many of my colleagues, we all hear the same stories. We all hear the same concerns of from clients. Because of what is coming, they they are afraid of applying for certain services because they don't know how it's going to affect them. Um, but it is a great relief to know that they can rely on the free groceries that Second Harvest provide. And with that, I pass it back to Leslie.
Thank you, Patricia, and thank you, Robert, for just giving us an idea of how these changes are going to impact us at the county level. And Patricia, thank you so much for illustrating just the very real impact these changes have on the lives of our neighbors, and also just illustrating what a stifling impact immigration fears is having on our community and people's comfort accessing services. I want to talk a little bit more about what these policy changes mean for the families and the individuals who may have fewer resources to cover their basic needs, including food. We know that whenever CalFresh is cut, that our lines get longer. We saw this at the end of the pandemic when people no longer received the maximum benefit amount as soon as those changes went into effect. And of course, as people were hearing from our counties that their benefits would decrease, we saw our lines get longer again. And in November, we also got a very real glimpse of the impact of these CalFresh changes on our services. As soon as people heard rumors of not receiving their benefits in November, we saw the calls to our Food Connection hotline, the hotline that Patricia described, double. And we saw, 3 times the number of people coming to our food locator tool, again, trying to get connected with services. That's why we're all bracing for what it will look like when we begin to really see the impact of these HR1 changes on CalFresh and on families and individuals in our community. We know it's going to put an additional strain on the entire safety net. And again, this amazing network of 400 partners that I described earlier. If you can go to the next slide. We do know that SNAP is the best way for folks to receive food assistance. It's the largest and most effective anti-hunger program in the country. We know this is a program that works, and it's not a program that food banks can replace. It can't be replaced by private funding. It can't be replaced by additional, state resources or county resources. For every meal provided by food banks in California, 9 are provided by CalFresh. It really is a critical anti-hunger program. In our high cost of living region, because the benefit is not adjusted for the local cost of living, 2 working adults often earn too much to qualify, even if they are only earning minimum wage, the local minimum wage. And we also know, because it's not adjusted for the cost of food in our community, even if you're eligible for the benefit, it may be inadequate. And we know that with the changes to HR1, fewer people will qualify both for CalFresh and Medi-Cal, and that is going to have a big impact on people's abilities to meet their basic needs. Go to the next slide. We have already taken some steps to try to provide additional support in our community. I alluded to this earlier, but we have committed to increasing our food purchasing budget for the rest of our financial year that goes through June 30th and for the next year, because we know these changes are really going to hit our community hard. And so we have made a commitment to add additional items like milk every single distribution, and we added eggs back to our menu, and trying to ensure we have more critical staples as part of that, in addition to all the fresh produce. Rachel's going to talk a little bit more about the Cal Food program, which is funding we receive at the state level that also helps us be able to purchase these critical items. We are in regular communication with our county partners like Robert to understand the timeline for these changes. We're looking at ways to promote volunteerism at our site as a pathway to maintain CalFresh eligibility as these work requirements kick in. And of course, we're working on communication materials to clearly and simply explain what is changing and what steps CalFresh recipients will need to take to maintain eligibility. It won't fully offset the CalFresh dollars our families and local economy depend on, but these are all important steps to help our communities navigate this really difficult moment. And of course, no matter what happens, our commitment remains steadfast to do all we can to continue to ensure folks have access to nutritious food. But of course, we can't do it alone. We do need your partnership. And I'm going to turn it over to Rachel to talk a little bit more about our policy agenda this year. Really, advancing systems change is core to our mission. Through our services, we are providing immediate relief today, and we're also looking to impact policy changes at the federal and state level that will help us achieve the really long-term meaningful impact we want to have on our neighbors' ability to feed their families. Our policy agenda this year is primarily in response to the changes to HR1. Again, we know how what a negative impact that's going to have on the lives of our neighbors and just the general erosion of the safety net. So we're going to be looking for ways to delay or reverse some of the harmful HR1 provisions. And now I'd like to give Rachel a chance just to walk you through our key priorities.
Thank you, Leslie. Over the last couple of months, I've sat through a number of these presentations talking about HR1, and when I walk away from them, I always feel this like very, very heavy, heavy feeling. So we've done that part for the first half of today's presentation, but we're going to shift gears to hopefully inject some hope. So some very specific actions that we can all take today at every level of government and at the community level to help support our neighbors through this really challenging time. I'm going to start off by talking about CalFood. The CalFood program is very unique to food banking. So if you're not in the food banking space, you are probably maybe learning about this for the first time. Like Leslie mentioned earlier, this is a really critical source of funding for food banks across the state. It allows food banks to purchase Californian grown foods. We and other food banks across the state use our allocation to purchase highly perishable items that we can't really get donated that easily, like milk and eggs and protein items, as well as just a variety of items so that our clients are able to have their cultural needs met, their food preferences met, and just have some options for what they're able to serve their household. In addition to all of the cuts that we've talked about related to HR1, the Cal Food program is facing a $72 million budget cut at the state level this year. That is an additional challenge for food banks like ours in order to meet the need that we're expecting as a result of HR1. So the ask this year is for the state of California to bump up our baseline funding for CalFood from $8 million up to $60 million, which is what we've seen during the course of the pandemic, and it's more in line with what other states across the country provide to their food bank networks. We're also asking for a one-time infusion of $50 million to help the food bank network prepare for additional people in need of food assistance as a result of HR1. Like Leslie mentioned, people are going to lose access to CalFresh, they're going to lose access to Medi-Cal, and often people turn to food banks like ours as a way to offset their household budgets when those other services are cut. Thank you. Our shifting gears to specific policy items, we're really looking for any opportunity to defend, to restore, and to strengthen the CalFresh program. It is the most effective anti-hunger program that we have in our tool belt, and it's something that we really need to look for ways to strengthen so that it's able to support our community. So there are just three policy areas that we're really focused on that I wanted to highlight for you all today as it relates to CalFresh at the state level. Jenny, if you can go to the next slide for me. Thank you. The first is the CalFresh Fruit and Vegetable EBT pilot program. This is a statewide pilot that has, in the past couple of years, been funded at very, very small amounts. It allows CalFresh recipients to double up their CalFresh dollars when they're purchasing produce at participating grocery stores. In our region, we only have 5 locations. So the budget ask of $100 million would allow the pilot to operate year-round, because right now it only operates for a couple of months before it runs out of funding, and to expand the number of grocery stores that are able to participate in this. Another item that we're tracking that is in direct response to the work requirements and the time limits that Robert talked about earlier at today's presentation is AB 2299. It's the CARET program, which is the California Anti-Hunger Response and Employment Training Program, CARET. This would provide state-funded food assistance benefits for individuals who are cut off from CalFresh as a result of running up against that 3-month time limit because of the work requirements that Robert described. And also, it's really, really rare for us to ever take an opposition stance on policy, but there were 2 this year that we just felt like we couldn't ignore. And they're companion bills, so they do the same thing. One's an Assembly bill, AB 2171, and the other is a Senate bill, SB 1134. These bills would collectively have the state of California request a waiver to restrict what items CalFresh recipients are able to purchase. Our organization, our network, has always taken the stance of providing incentives to encourage people to purchase healthy, nutritious items for their households. like the CalFresh Fruit and Vegetable EBT pilot program. This is the opposite. It is a punitive approach. And our real main concerns here are that it doesn't allow for flexibility with cultural relevance, with food preferences, and it just makes it really, really harder for people to get the food that best meets their needs. We trust that people will be able to purchase the things that they need and that they can make that decision for themselves. Thank you. Of course, we can't talk about CalFresh, about SNAP, without talking about the Farm Bill. The Farm Bill is a very large federal legislative package, and despite its name, Farm Bill, it's actually extremely important for SNAP. Again, that's CalFresh here in California. 82% of all of the funding that is directed through Farm Bill goes to SNAP or to TFAP, which is the Emergency Food Assistance Program. There's a lot of acronyms in food assistance programs. Leslie earlier at today's presentation talked about USDA commodities and how important that is for our food bank to be able to source a great variety of food items. That is the TFAP program. These are those USDA commodities that's funded through the Farm Bill. This is currently being marked up at the federal level. The House has already put forward their version. The Senate, there's no timeline for that yet, but we know it's going to come soon. This is really the one opportunity we have to either reverse or delay some of those really harmful provisions that have gone into effect as a result of HR 1. In particular, we're asking for a 2-year delay on those cost sharing items that Robert mentioned, which is going to cost the state of California around $2 billion. So pretty significant impact there. We've talked a lot about CalFresh today, which is, again, the most important, the largest food assistance benefit program. But sometimes people are surprised to learn that school meals are the second largest food assistance program. Here in California, we were the first state in the nation to guarantee that all TK through 12th grade students were able to eat 2 meals every day at school at no cost to them or to their families. And since then, I believe 8 other states have followed our model. California is always a trendsetter. Our ask here is really simple. We're asking the state of California to maintain its commitment to fully funding the Universal School Meals Program as participation increases, as we look at providing more scratch cooking, upgrading kitchens, upskilling our nutrition directors, and just providing the resources that our schools need to serve great meals to their students. And of course, HR 1 is also going to impact student nutrition programs. The safety net is truly a net. All of these programs are interwoven with each other. As fewer families are eligible for CalFresh or for Medi-Cal, fewer students will be receiving federal dollars to fund their school meals. If you receive CalFresh, then you get federal funding for your meal. If you don't, then the state has to step in to fill in that gap. It also means that fewer students will be automatically eligible for Sunbucks, which is a summer nutrition benefit that helps students bridge the gap while school is out. And of course, while we will always celebrate our Universal School Meals program, there are still opportunities to improve the program. Over the last year and a half or so, we've worked really closely with the University of California's Cooperative Extension to study barriers to students accessing school meals. And a really key one that we saw was that students simply do not have enough time to eat their meals. If you have school children at home, this is probably not a surprise to you at all. But we do have a report linked here, so afterwards we'll share it. And finally, I just want to talk a little bit about our grocery rescue program. Again, Second Harvest of Silicon Valley is the leader in edible food recovery across our region of San Mateo and Santa Clara counties. Last year, we recovered around 17 million pounds of food from grocery retail stores. That's Safeways and Lucky's and Ortega's and Molly Stone's and Amazon Fresh and all of those kinds of stores. Together, us and our partner network conducted 820 food pickups from grocery stores every single week last year. So it is an incredibly involved, highly effective way to get food to people who need it. And in addition to being a great way to get food to people who need it, our grocery rescue program is very deeply rooted in sustainability. The amount of food that we recovered last year is the equivalent of taking 5,900 cars off the road in terms of carbon emissions saved. But edible food recovery, though it has greatly expanded as a result of SB 1383, still needs funding to make the system sustainable. So there is a funding budget request this year being put forward by Stop Waste and other food recovery advocates across the state to provide $29 million in Cal Recycle grants, which would support organizations like ours who are conducting food rescue. Thank you. So we've talked a lot today about very high level, sometimes theoretical concepts of food access and policy and all of that. I just wanted to bring it down a little bit more as we near the end of our presentation today to what we're seeing again at the local level. I'm going to hand it over to Alex Navarro, our Director of Community Health and Nutrition, to talk a little bit more about our nutrition team and how they partner with our agencies across San Mateo and Santa Clara County to support the health and well-being of our neighbors. Alex, off to you.
Thank you, Rachel. Hello, everyone. I do want to start quickly just about sharing what the Community Health and Nutrition Department does. One of many things is we're out in community really trying to build these deeper relationships with our partners. And what this does, it's going to allow us to essentially provide really key nutrition and culinary education that is going to be rooted in improving the well-being of our neighbors. So across both counties, we implement targeted initiatives that support positive, equitable health outcomes, really aimed at fostering a resilient and thriving community. And at Second Harvest, we know that providing nutrition food is such an essential part of building a healthy community, and that supporting individuals with knowledge, with culture, and connection around food can be just as important. Next slide. So that is exactly what our partnership with ALAS is doing with farm workers on our coast in in San Mateo County. Our farm workers who harvest the foods that feed our region often face some of the greatest barriers to accessing nutritious meals, resources, and community support. So for today, I will briefly walk you through this partnership so you get a sense of how trusted relationships with our partners really reflect our commitment to working deeper in community. So a little bit of background with ALAS, which is Ayudando Latinos a Soñar, translates to helping Latins dream. In 2022, they launched their food pantry, and this was after identifying a need for additional resources, and they were seeing high levels of food and nutrition insecurity in their areas. So as this partnership grew, both Second Harvest and ALAS realized that access to food alone wasn't going to be enough. So we started to explore other ways that we could support this underserved community. What we learned was that many farm workers live on the farm where they work with limited health resources, limited transportation, very challenging living conditions, and most often they're away from their families for extended periods of times. So we identified the need for more community connections. We paired that with nutrition and culinary education that really reflected the culture and their lived experiences. So I wanted to highlight this photo here. I took it when I last visited the farm. You see the rows and rows of, we'll go back to that last photo because that's the photo of the farm. You can see just all the Brussels sprouts, just beautiful, luscious produce. It's right off the coast. It's got a beautiful beach view. One thing that you can see through this photo is you can't see the tough labor, the long hours, the less than ideal living conditions. There was also so much immigration fears that really prevented the farm workers from going out and doing their job and feeling safe about it. And on this particular farm here in Half Moon Bay, we met 12 farm workers that lived together in one small house. Next slide, Jenny. So to address the lack of accessible resources, we created an on-site workshop class. We brought it directly to the farm, and this helped eliminate any barriers such as transportation and time. And also, we wanted to ensure that we provided it in a safe space where they felt comfortable to be able to collaborate with us. So we worked with the farm workers to design a Spanish language series, and this was focused on topics that they identified were most important, which I thought was so key that we brought them into that conversation. Each session included cooking together, sharing meals, and self-care through food and nourishment and even some movement. We showed up with the intent to learn from one another, where everyone had a space at the table, and you can see it here in this photo for yourself. I don't have a link for it here, but if you want to learn more about this initiative, we did create a community impact report on our website, and it's called the Farm Workers Table. And there you'll read how grateful this community was to receive all of these nutritious groceries from Second Harvest. They were able to create healthy meals to keep them going through the day. And, I want to emphasize that this work was more than just providing nutrition information. It was really about building trust, celebrating culture, and creating a safe space where farm workers were able to really connect and learn and support from one another. And this partnership with Second Harvest and Alas is also a really powerful example of how community-centered and culturally grounded work can really help advance health and dignity and connections. And I think for our whole organization, it really strengthened our understanding of what a strong partnership can look like. So today we continue this work out at the farms. Alas collaborates with approximately 550 farm workers across 26 farms. So we've extended our services to the farm workers' families. We're currently attending one different farm each month, which is really great work. So I will just close by saying when we invest with farm workers' health and when we invest into their well-being, we're not only supporting the people that nourish our region, but we're also strengthening the health and the resilience of our entire community. Thank you, Rachel. Thanks for having me.
Thank you so much, Alex. I always love hearing what you're what you're working on, and yeah, the absolute importance of our farm workers and how integral they are to the entire food system chain. Right there, they're right there at the start. So we're almost out of time for today, but we have a couple of takeaways that we wanted to leave everyone on the call with, and then we'll have some time for Q&A afterwards. So hopefully you're feeling really energized, you're feeling really hopeful. You're like, okay, here's what's happening. Here's some ways that I can get involved. But again, that's federal, that's state. What can I do right here? So we're encouraging anyone on the call from our local cities to assess the community food needs of your residents. Patricia talked a little bit about our Food Connection team. They can absolutely be a resource to you. So you can provide referral information for anyone who is in need of food assistance. We also have a fantastic volunteer program if you're looking for opportunities to get the team out of the office. We always need volunteer support, and for any community members who are looking for a way to get more directly involved in supporting their neighbors, our food distributions are a great way to do that. And for our county partners who are on the call, we ask you to continue to be the great partners that you are. Continue to collaborate with us, continue to collaborate with our partner network, and look for opportunities to invest in food access and root cause solutions like housing and other income supports. I know that funding is tight at every level of government, but when you start stripping away the safety net, it really has long-term lasting effects on our local population. And for our state folks on the call, I'm just going to reemphasize the importance of the Cal Food program. We are asking for that baseline funding for Cal Food being raised up to $60 million ongoing. And for federal folks, we're looking for ways to invest and improve nutrition programs. We've seen unprecedented attacks at the food assistance safety net over the last year, but there are opportunities to walk some of that back to reverse some of those harmful provisions. So we're so grateful for everyone's partnership, and we look forward to continuing to be thought partners with all of you on all of this. And we do have time for Q&A, so I'm going to go over to the chat box and see. We have one question in the chat for Robert, if you're available, Robert. Do you know the percentage of CalFresh recipients that you expect to lose benefits in HR 1? And then just a clarification of when these provisions go into effect. Oh, sorry, you're on mute, Robert.
I'm going to have to get back to you on the numbers, but the effective date, the work requirements come in June 2026.
Thank you. Are there any other questions? All
All
right.
right, Rachel, maybe yeah, I should go ahead and wrap it up, but I just want to thank all of you for participating. I see in the list of participants so many of our nonprofit partners, so many of our government partners, and we truly could not do this work without you. I have to say, I find it easy to get discouraged when you think about these lasting impacts through HR1 that are going to be quite harmful to our community when you consider how difficult it is to navigate in the midst of all of these immigration concerns and fears. But what gives me hope is being part of this community where we do have so many powerful partnerships and so many folks like yourselves who are really invested in showing up for our neighbors and trying to ensure, even in these challenging times, that everyone has access to the nutritious food we all need to thrive. So thank you for your partnership. Again, it does leave me feeling very hopeful. And I hope that if you have questions after this, you won't hesitate to reach out to anyone on our team. I want to thank, of course, the participants today. Thank you, Robert, for joining us. Thank you for Alex and Patricia for sharing your stories. And thank you, Rachel, for facilitating such a great overview of what's ahead.
Thank you. Um, Leslie, there is a question in the chat.
Okay.
Um, do you, is there a way to have more active communication to know who is distributing food in zip code areas?
Well, the best thing to do is to go to our food locator tool. If you go to our website and you click on Get Help and you enter your zip code, you can see where food services are available within your zip code. You can also find on our website our Food Connection hotline number, and you can call and talk to one of our multilingual staff members who can help assist if you're having trouble navigating. That food locator tool can help assist you in finding a location near you.
And Robert, for you, there's a request to have social services agency staff to come and provide outreach at a specific location. Can I provide your contact information for that request?
Sure thing, and we can have a conversation and see who the appropriate folks would be depending on that event.
Okay, I think that's everything. I hope you all have a fantastic day, and thanks again for joining us.
Thanks, everyone.